Hello friends, I am Dr. Ashish Agrawat. Welcome to my channel Live Biochemistry. Today we will discuss a very important case discussion on gout. So this is a case that is given a 32-year-old male who was working as a night watchman had consumed alcohol overnight. Now the next day morning he woke up with the severe pain in his left big toe with inflammation and redness of the joint. The laboratory investigation showed the uric acid level of 9.5 mg per deciliter. He was diagnosed as a case of gout and treated accordingly. He was put on allopurinol drug for the next 3 months. This is how the typical gout case where uric acid accumulation lead to the pain at the first metatarsal joint due to the accumulation of uric acid crystals. So what are the questions that can be asked in your exam? First question is how uric acid is formed in our body. Second question, what are the secondary causes of the gout? Third question, what is the role of allopurinol in treatment of the gout? And fourth question, why alcohol precipitates the attack of gout? And fifth question is, which group of drug is given to get the immediate relief from the pain? And name some uricosuric drugs. So we will see all these questions and what exactly you have to write in your exam for these questions. The first question is how uric acid is formed in our body. So uric acid, it is an end product of purine metabolism. What are the purines? They are adenine and guanine. So when they are degraded, they will form the hypoxanthine. Then from hypoxanthine, with the help of xanthine oxidase enzyme, it is converted to xanthine, and then xanthine is further oxidized by xanthine oxidase to form the uric acid. You can see the AMP and GMP via the nucleosidase enzyme, they will be converted to adenosine and guanosine respectively. Adenosine with the help of adenosine deamidase enzyme is converted to inosine. Inosine is further with the help of nucleotide phosphorylase is converted to hypoxanthine, while guanosine will be converted to guanine via nucleotide phosphorylase enzyme. Now this hypoxanthine with the help of xanthine oxidase enzyme converted to xanthine, while guanine is converted to xanthine via the guanase enzyme. Xanthine will be converted to uric acid via the xanthine oxidase enzyme, and this uric acid is excreted in the human beings. This was the first question, that how uric acid is formed in our body. So it is an end product of purine metabolism. When they are degraded, they will form the hypoxanthine and xanthine, and from xanthine via xanthine oxidase enzyme, they is converted to uric acid. Guanine will be directly formed the xanthine, while adenosine is converted to inosine, then inosine converted to hypoxanthine, and hypoxanthine will be converted to xanthine. So this is the difference how AMP and GMP is metabolized and degraded and form the uric acid. So this was the answer of your first question. This is a 2-mark question, and you have to write the pathway how nucleotides, mainly the purines, how they are broken down. Now coming to the second question, what are the secondary causes of gout? So here the secondary causes of the gout include either there will be increased uric acid production or decreased uric acid excretion. Why we need to learn this? Because based on the etiology, we can give the treatment. Suppose the cause is decreased excretion of uric acid. In that case, we have to give the uricosuric drugs like probenecid. While whenever there is an increased uric acid production, we will give the drugs like allopurinol or febuxoside. We will see one by one. So now coming to the what are the secondary causes of the gout. The secondary causes of the gout are increased uric acid production, which include hematological malignancy like leukemia, lymphoma, and the patient who is given the chemotherapy where there will be tumor lysis syndrome will lead to the increased uric acid production. Also the case like psoriasis where there is epidermal changeover and more DNA turnover lead to more and more nucleotide breakdown and lead to the increased uric acid level. Even starvation will increase your catabolic process and it will lead to the increased uric acid production in your body. So uric acid level is increasing. Now coming to what are the causes of decreased excretion of uric acid. The most important cause is renal failure. Other drugs like diuretic, thiazide, which is used in the hypertension, that may lead to the decreased uric acid excretion, or the condition where there is a lactic acidosis or ketoacidosis which will impair the uric acid excretion because it competes with the uric acid for the excretion. These are the secondary causes of the gout. Now, what will be the primary cause of the gout? So, causes of primary gout are two enzymes. They are overactive: phosphoribosyl amidinotransferase and PRPP synthetase. These two enzymes overactivity lead to the primary gout, while two enzymes deficiency. What are these two enzymes? One is the enzyme of the salvage pathway, that is HGPRTS, hypoxanthine guanine phosphoribosyl transferase. This enzyme deficiency lead to Leishman syndrome. Okay, and in that case, there will be the gout, there will be increased uric acid level. Also, in case of von Gerke disease, where there is a glucose 6-phosphatase enzyme is deficient. So, this was all about the causes of gout. That will be primary gout, where mainly either increased enzyme activity or deficiency of some enzymes, or that can be secondary causes of gout, where there will be either increased uric acid production or decreased uric acid excretion. Now, coming to the third question, that is, what is the role of allopurinol in the treatment of the gout? Now, this allopurinol is a structural analog of the hypoxanthine. So, what will happen? This allopurinol will, with the help of xanthine oxidase enzyme, it is converted to alloxanthine. Now, this alloxanthine, it is a strong inhibitor of xanthine oxidase enzyme. So, it will inhibit the xanthine oxidase enzyme. So, hypoxanthine to xanthine and xanthine to uric acid. Both steps require the xanthine oxidase enzyme. So, it will inhibit this step, and by that uric acid production will be decreased. And this hypoxanthine and xanthine, these both are the water soluble substance. So, they are more soluble, and so they will be excreted easily. This is a classical example of suicidal inhibition. Allopurinol, it is a competitive inhibitor of xanthine oxidase, while the newer drug like febuxostat, it is a non-competitive inhibitor of the xanthine oxidase. Both will help in decrease in uric acid production. Now, the fourth question is, why does alcohol precipitate an attack of the gout? The alcohol is metabolized in the liver. We know that alcohol is first converted to acetaldehyde, and then acetaldehyde is converted to acetate. Both steps requires the NAD plus, and NAD plus is converted to NADH. Okay, so there will be the decreased NAD plus level and increased NADH level. So the ratio of NADH to NAD, that will be increased. When this ratio is increased, it favors conversion of pyruvate to the lactate. As we know, pyruvate will be converted to acetyl-CoA and it will go to the TCA cycle. And here we require the NAD. But because here NAD is utilized for the metabolism of alcohol, so that pyruvate will be channeled to the other pathway, that pyruvate will be converted to lactate, and here NADH is converted to NAD. And here, as the lactic acid is produced, there are two mechanisms why it will lead to the gout. Whenever the lactic acid level in the blood is increased, lactic acid, it will interfere with the excretion of uric acid. It will impair the excretion of uric acid because it will compete for the excretion. So, the uric acid level will be increased. Another cause is lactic acid will decrease the pH. Environment is more acidic, uric acid is poorly soluble in the decreased pH in the acidic medium. So, this reduced solubility leads to precipitation of the urate crystals in the joints. This is how the uric acid crystals is seen in the urine microscopy.
So we see the sequence again. Alcohol lead to the increased NADH ratio. Increased NADH ratio will lead to the increased lactate production. Once the lactate production is increased, it will lead to the impaired excretion of the uric acid and lead to the uric acid level increase. Increased lactic acid level also decrease the pH. In acidic medium, uric acid solubility will be decreased and lead to the urate crystal precipitation and lead to the gout. So this is how alcohol precipitates the gout. Now the last question, which group of the drug is given for intermediate relief of the pain, and name the uricosuric drugs. So here the pain relief is non-steroidal anti-inflammatory drugs, that is called NSAIDs. The generic name is diclofenac sodium and ibuprofen. So they will act as a anti-inflammatory drugs. How they act? They will inhibit the synthesis of the prostaglandin. The key enzyme of prostaglandin synthesis is cyclooxygenase. So NSAIDs will inhibit cyclooxygenase enzyme. By that, they inhibit the prostaglandin synthesis, and by that, they will have a anti-inflammatory actions. So the pain is reduced. So this is the first line of treatment. In severe case, you may give the corticosteroids that will inhibit the phospholipase A2 enzyme, and by that the lipoxygenase pathway and prostaglandin pathway is inhibited. Now, what is the uricosuric drugs? So whenever there is an interfere in uric acid excretion, we can give the uricosuric drugs. What these drugs will do? Drugs like probenecid will increase the uric acid excretion. They act by inhibiting renal tubular reabsorption of the uric acid. So this is how probenecid works. I hope you find this video helpful. If you like this video, please hit the like button, give your feedback as a comment in the comment section, and subscribe to the channel. You can also visit my website www.livebiochemistry.com, where you will get study material regarding the biochemistry. Thank you for watching. Bye.